As I look back on my 2 tours of duty as a flight surgeon in the United States Air Force and nearly 20 years as an emergency physician, I can name dozens of stressful situations where literally seconds counted as human lives hung in the balance. Some of the most demanding circumstances I've experienced were code blue situations, where a patient's heart stops beating. Despite modern medical interventions, not all of those patients survived, unfortunately. Yet many of those scenarios could have been prevented. Yes, I did say prevented. Hello, I'm Dr. Neil Sechrist. I'm a board-certified physician practicing both emergency and family medicine, and I have some intriguing information for you. Information so vitally important that not only will it improve your health, but it might just save your life. My message comes from the heart, from my heart to your heart, and I do mean your heart. That specialized cardiac muscle that pumps blood through thousands of miles of blood vessels each second. So important that without it, we die. This specialized CD will give you a brief overview of the only natural alternative for complete cholesterol care that is clinically proven. I will then introduce to you a world-renowned cardiologist, and you'll hear his perspective on this medical breakthrough. And on the final tracks, you'll hear from several additional medical doctors, all thought leaders in their respective specialties, and what impressive results they are experiencing using this formulation in their own practices. You see, not only is cardiovascular disease the #1 cause of death in North America, it is also the leading cause of death in the world. According to the American Heart Association, cardiovascular disease kills one person every 36 seconds. That's about 2,400 people each day, claiming more lives than cancer, HIV, or Alzheimer's disease combined. A lead cause of cardiovascular disease is an imbalance of cholesterol. Too much bad LDL cholesterol and not enough good HDL cholesterol. This imbalance contributes to a buildup of cholesterol plaque on the walls of our arteries that can, without warning, rupture, resulting in blocked blood flow. If that blood flow goes to the brain, the patient has a stroke. If the blood flow goes to the heart, the patient has a heart attack. Everyone knows that heart attacks can stop a beating heart. The good news is that cardiovascular disease is largely preventable. But how, you ask? Introducing BioSlife, a unique matrix of specialized fibers, antioxidants, and other natural components that offer numerous health benefits toward cardiovascular disease, diabetes, and the metabolic syndrome, as well as improving our body's immune system. The benefits of BioSlife have been clinically proven in at least 8 scientific trials at some top universities, hospitals, and research institutions around the world, including the prestigious Cleveland Clinic. These studies show that BioSlife reduces bad LDL cholesterol by an average of 31% and improves good HDL cholesterol by an average of 29% in only 8 weeks. In addition, high triglyceride levels were reduced by an average of 40%, and continued use shows even further improvements. There is no known clinically proven drug or natural product in the world that offers these 3 combined benefits to help reduce the risk of cardiovascular disease. Unlike prescription medications, BioSlife is a true cholesterol optimization formula. Not only is it equally effective as statin medications at lowering bad LDL cholesterol, it is also up to 3 times more effective at increasing good HDL cholesterol. These studies have gained the attention of the American Heart Association, who wrote a press release on BioSlife educating their members on its benefits. BioSlife is also clinically proven to improve blood sugar levels, something important to those battling diabetes or the metabolic syndrome. Our modern diets and processed foods cause rapid fluctuations of glucose and insulin levels in the blood. These peaks cause cellular damage and pancreatic stress. The lows cause lack of energy and stimulate hunger. The fiber matrix in BioSlife limits these peaks and valleys of blood sugar and reduces the glycemic index of our foods. This gives us more energy during the day, helps prevent cravings, and can even help you lose weight. Additional clinical studies in diabetics show improvements in the blood sugar levels after meals and their overall disease management. The added proprietary chromium helps insulin sensitivity and promotes lower average blood sugar levels. This scientific work has been recognized by the American Diabetes Association. BioSlife is recommended by thousands of doctors and healthcare professionals and is found in the Physician's Desk Reference, or PDR. Its formula and its manufacturing processes are protected by 2 U.S. patents. Since the introduction of the original BioSlife in 1991, sales have exceeded $1 billion. I wish more of my Code Blue patients over the years could have learned about BioSlife before it was too late. It might possibly have prevented the situation in the first place. Being in charge during these cardiac arrest scenarios can be quite stressful, as you might imagine. These conditions require quick, clear, and concise thinking, medical expertise, and an unusually calm personality. It's exactly these personality traits that define my colleague, cardiologist Dr. Jerry Bresnahan. Most medical doctors are accustomed to being on call as a part of their medical responsibilities, but very few doctors are chosen to be the on-call cardiologist for possible patients such as the President of the United States, the Queen, or for the Pope. Those were just 3 of the many dignitaries that Dr. Bresnahan has been responsible for. Jerry graduated in 1967 from the Stritch School of Medicine at Loyola University in Illinois. He's a fellow of the American College of Cardiology. He's presently medical director of intensive care units and telemetry units at a major heart center in Los Angeles and the chairman of the Cardiothoracic Committee at a major heart center in LA. Jerry's been on a personal crusade for the prevention of cardiovascular disease ever since his father died suddenly at age 54 of heart disease. He's taken this campaign to major cities around the world, and how lucky we are to be able to listen in as Dr. Jerry Bresnahan shares his passion about the best way to prevent cardiovascular disease. It's my privilege to introduce to you Dr. Jerry Bresnahan.
Thanks, Neil. It's a pleasure to see so many of you here today. Such a beautiful afternoon in Los Angeles. I know there are a lot of other things you could be doing. But I guess you're here today because you're concerned about heart disease. And well, you should be. Over 1 million unsuspecting people will die this year from heart disease, making it by far the #1 killer in the developed world. And I say unsuspecting because I've taken care of thousands of people who have had heart attacks, and every one of them is absolutely shocked that it happened to them. Because heart attacks happen to somebody else, even if I have all the risk factors and I don't take care of myself. Well, somebody dies from a heart attack every minute. Somebody has a heart attack every 26 seconds. Now, when I start talking about heart disease, I see some of the ladies kind of get that glazed look in their eye. Because after all, heart disease is what happens to men. Women die from breast cancer. We know that, right? Actually, nothing could be further from the truth. Not only do more women die from cardiovascular disease than from breast cancer, but then from all cancers combined. In fact, more women die from cardiovascular disease than the next 7 leading causes of death combined. So ladies, I think it's just as important for you to listen up as well. I was recently at a social event. This guy walked up to me and says, "Hey doc, I've heard a lot about you. I'd like one of your cards. If I have a heart attack, I'm going to give you a call." I kind of smiled as I gave him the card, but as he walked away, I got to thinking. I said, you know, what if that guy really did keep that card in his pocket and then he did have a heart attack? There'd be a good chance he would never even be able to get that card out of his pocket before he died. Because half the men and almost 2/3 of the women that die suddenly from a heart attack had no previous symptoms. The first symptom is they just die. And this is tragic because we now know that heart disease is 80% preventable. Yes, I did say 80% preventable. So we need to start looking for ways to help prevent, not just treat heart disease. And actually, when I treat a person that's had a heart attack, I know I've already missed the most important part of that treatment, the prevention part. I've seen just too many people after they've had their massive heart attack, after they're already in heart failure, after the heart stopped for a while and their brain's been damaged. And the reason I have such passion for such heart disease prevention is I've seen just too many of what I sadly call these Humpty Dumpty hearts. They're broken, and I just can't put them back together again. So if we're looking for ways to help prevent heart disease, we need to look at some of the major risk factors for heart disease and see how we can favorably affect them. Some of these major risk factors are high cholesterol, high blood pressure, obesity, diabetes, and smoking. Let's first look at cholesterol. There are, of course, as you know, different types of cholesterol. There's the LDL or bad cholesterol, HDL or good cholesterol. People say, I can't remember which one is which, doc. Remember L is for lethal. You don't want LDL cholesterol. H is for healthy. You want HDL cholesterol in your body. You don't want the LDL cholesterol because it's a sticky little molecule. It clings to the blood vessel wall and forms those plaques in the arteries that start to block up the arteries. They can become inflamed. They can rupture. A clot forms at that area of the heart. The blood flow to that part of the heart stops. That part of the heart muscle dies, and you have that catastrophic event, the heart attack. Now, for every 1% you lower your LDL cholesterol, you actually decrease your risk of heart disease by 2%. So it's really vitally important that we figure out good ways to reduce our LDL cholesterol. Now, HDL is just the opposite of LDL. It's the good kind of cholesterol. It's the healthy kind of cholesterol. It actually fights plaque. It actually takes the LDL cholesterol, binds it, and transports it harmlessly to the liver. So not only it fights plaque, it may actually help prevent disease, maybe even reverse heart disease. So it's also vitally important that we find ways, although it's sometimes really difficult, to increase their HDL cholesterol. Because for every 1% you increase your HDL cholesterol, you actually reduce your risk of heart disease by 3%. Now, I think we all know how we should lower our cholesterol. I think we all know that we're supposed to exercise more, reduce our weight, and watch our diet. We need to cut down on our cholesterol intake, our saturated and trans fats, and our refined sugars. And we need to increase our intake of fruits and vegetables and fiber. We all know that, right? See some people smiling. We all know that. The problem is that most of us just don't have the discipline to do it on a regular basis. But even if you did have the discipline and did do all those things, a lot of you would still have high cholesterol because of genetic factors. I don't know if you realize it or not, but only 25% of the cholesterol in your blood comes from what you eat. The other 75% is made by your liver. And a lot of times the liver just makes too much. So what do you do when that happens? Well, if you go to your doctor, he'll probably start you on one of these prescription statin drugs. Statin drugs are the most popular drugs in the world. In fact, the 2 top selling drugs in the world are statin drugs. And they account for a $25 billion price tag every year. They lower cholesterol just one way. They decrease the production of cholesterol in the liver by blocking an enzyme. Do statins work? Yeah, they work pretty well. They lower the LDL bad cholesterol by an average about 32%. But they're not so hot at raising the HDL. They only raise it by about 7%. That's not so good. People always ask me, do I personally use statin drugs as a cardiologist? The answer is yes, sure. I use them all the time. I use them for many acute and chronic heart problems. In fact, I think it's mandatory to use statins in certain situations. But for healthy people that are just trying to lower their cholesterol, I think there are better ways. Why do I say that? Well, 10 to 20% of the people have difficulty tolerating statin drugs. If you actually looked it up in the physician's desk reference, you'd see several pages of potential side effects from the statin drugs. They work on the liver, so they can often inflame the liver. And you have to take serial blood tests to make sure that this doesn't happen. They can also cause muscle problems. Usually starts with just muscle cramps or muscle pains that shouldn't be there. It can progress to a severe problem in which the muscle fibers in the body actually are absorbed into the blood. They can travel around and cause a myriad of problems. I once saw an unfortunate man who had had this kind of a problem. He had been started on a statin. He was a healthy guy in his 40s, just wanted to lower his cholesterol. When I first laid eyes on him, he was in the emergency room at our hospital on a ventilator. He was on a ventilator for a week. He had a stroke. He lost entire function of his kidneys and was on chronic hemodialysis. And this was just a young, healthy guy in his 40s that wanted to lower his cholesterol. It's important also to note that as the statin dose increases, the relative effectiveness of the drug usually decreases. For example, I saw a guy who had a high cholesterol and he was started on a statin, and the initial dose dropped his LDL by 50 points. It was still not enough, so the dose was doubled, but instead of lowering it by another 50 points, it only lowered it by 10 points. And he started to have muscle pain, a potential problem. This illustrates another problem with statins. As you increase the dose of the statin, the potential side effects increase very, very steeply, even though the effectiveness of the drug doesn't increase by that amount. And as the dose increases, you sometimes reach what we call the statin floor, which means that the cholesterol can't be lowered any further by using a statin, either because you've reached the maximum dose of that drug, or because, like the man I mentioned earlier, you reach a point where increasing the dose causes him to have symptoms. Now, when that happens, if you go to your doctor, what would usually occur is that you would start you on a second drug that lowers cholesterol by a different mechanism. And each of these drugs also has potential side effects. A lot of times these drugs can interact with the cholesterol medication, the statin drug, to actually compound those side effects. Now, one drug company actually put 2 of these medications together. And the CEO of the company was quoted as saying, "This is an innovative treatment and a major advance in cholesterol therapy." Well, if treating cholesterol in 2 ways is called an innovative treatment and a major advance in cholesterol therapy, what do you call something that decreases cholesterol in 4 ways? You call it BioSlife. BioSlife is the flagship product of the Unicity company. You know, to make life better, people. The original formula consisted of several types of soluble and insoluble fiber, mostly soluble fiber, with powerful antioxidants, and vitamins, and minerals, and trace elements like chromium. Recently, 3 new ingredients were added to increase the efficiency of this product in lowering cholesterol, and it became known simply as BioSlife. It's a powder. You mix it in water or juice and take it about 10 minutes or so before you eat. It forms a gel in your stomach. And then these ingredients act together to do some really terrific things. First, let me talk about the importance of fiber in BioSlife. If you listen to the American Heart Association, American Diabetic Association, they'll tell you that you should have 30 grams of fiber in your diet, but the average diet has what? Only about 12 grams. And soluble fiber is especially important because it binds cholesterol-containing molecules called bile acids. And it holds them, they're swept out of your intestines, and you thus decrease your cholesterol by this mechanism. There was a placebo-controlled double-blind study that evaluated the importance of this mechanism using BioSlife 2 at the Cleveland Clinic, which many people consider to be the best research heart center in the country. And this study showed that you could decrease LDL, the bad cholesterol, by about 11% just using fiber. And also there are harmful elements to the heart found in the blood with nasty sounding names like apolipoprotein B and homocysteine, which were also decreased by an average of 20 and 11% respectively, believe it or not. Fiber is also very important in controlling diabetes. There are 20 million diabetics in this country, and 6 million don't even know it. Diabetes is a very insidious disease, and very often serious damage can be done to the body before it's even diagnosed. Diabetics usually have vascular disease. In fact, most people with diabetes die as a result of cardiovascular problems. And poorly controlled diabetes is associated with a new set of problems, such as blindness and kidney disease and peripheral vascular disease. So it's extremely important to prevent these wide swings in blood sugar that we see so often in diabetics. There was an article in the New England Journal of Medicine that talked about the importance of soluble fiber in diabetics, and the study showed that indeed you can control those wide swings in blood sugar with soluble fiber, and also help to control the lipid abnormalities that are virtually always associated with diabetes. Soluble fiber actually decreases the rate at which the carbohydrate that you eat gets into the bloodstream. So it lowers the blood sugar, it keeps the insulin levels lower, and it actually helps control the diabetes much more carefully. It's been estimated that for every 10 grams of fiber that you increase in your diet daily, you decrease your risk of diabetes 30%. Dr. Peter Vertigan recently presented a study at the American Heart Association Conference on Atherosclerosis, and he illustrated the importance of this principle using BioSlife. In a 90-day study, he showed that BioSlife decreased the LDL cholesterol by 29%, increased the HDL by 22%. And others have shown a significant decrease in blood pressure and in hemoglobin A1C, which is really the hallmark of diabetic control, using BioSlife. BioSlife also contains a niacin-bound chromium compound. It's the most bioavailable chromium. And this has been shown to be important in carbohydrate metabolism, as well as for maintaining favorable lipid ratios. You also need to remember that fiber is very important in cancer prevention. A high fiber diet may significantly reduce your risk of prostate, colon, and breast cancer. And a high fiber diet may also reduce your blood pressure. But I said BioSlife worked 4 ways. The first one is obviously fiber. What are the 3 new ingredients and how do they work? Well, the second mechanism is with phytosterols. Sterols have a structure almost identical to cholesterol, but they're harmless, and they block the transport system of cholesterol. What does that mean? Well, let's suppose that there's a bus. Don't tell people there's a bus in your heart somewhere, but let's suppose there's a bus. And the bus actually transports cholesterol from the intestine into your bloodstream. Now, the bus driver only lets cholesterol on this bus. But the sterols look so close and so almost identical to the cholesterol that sometimes he gets fooled, and several of the sterols get on the bus and take seats. And there are only so many seats on the bus. That means some of the cholesterol can't get on the bus, so it's swept out of your intestine, and you thus lower your cholesterol. Fascinating mechanism. The third mechanism is with polycosanol, which is a sugarcane natural derivative. Polycosanol actually blocks the same enzyme in the liver that's blocked by the statins. That does this without any harmful side effects. And blocking this enzyme, of course, reduces your cholesterol level. The fourth mechanism is with a flower, Chrysanthemum morifolium. It's been used for centuries in China as an herbal tea. And it's been shown that chrysanthemum morpholeum actually enhances an enzyme in the blood which inactivates the cholesterol. So it also, by this mechanism, decreases your cholesterol as well. Recently, an 8-week study by Dr. Vincent Duenos using this new BioSlife formulation studied effects of these 4 mechanisms on 96 patients. And those that started with a high LDL, he found that he could reduce the LDL cholesterol by an average of 31%, and in some as much as 52%. And I mentioned earlier that statin drugs sometimes reach the statin floor and you can't lower the cholesterol any further using the statin drug. He also gave BioSlife to a group of people already on statins and found that he was able to lower the LDL cholesterol an additional 20%. So an extremely important niche for BioSlife is in people who are already on statins. It may allow them to break through the statin floor when they can't take a higher dose of the statin. It may allow a lower dose of the statin to be used and thus decrease the potential for side effects. And remember how important I said HDL was? BioSlife increased the HDL by an average of 29% in those with the decreased HDL, and some of them improved by as much as 85%. When I first heard these results, I was really stunned. I honestly never expected that an all-natural, non-prescription product could do something like this. I didn't think it was possible. But I actually know of nothing, not even the most powerful prescription drug, that can do this combination of things. Now suppose you decide to take BioSlife and you talk to your doctor. He may not know much about it. And if this happens to you, just tell him to look it up in the physician's desk reference. The PDR is a 3,500-page book that virtually all doctors have on their desk. And it talks mostly about prescription medications and what they're used for and their side effects and so forth. And BioSlife is the only natural, non-prescription supplement in that entire 3,500 pages that does what it can do, which is quite a feat in itself. By the way, I never tell people to stop taking their prescription medications and start on BioSlife. I always tell them to talk to their doctor and then just add BioSlife to the present regimen. And then when they get a terrific result, they can discuss decreasing their statin dose or their diabetic medication or their blood pressure medication with their doctor after that. Now, I mentioned earlier that BioSlife forms kind of a gel in your stomach if you take it about 10 minutes before you eat. So when you actually sit down to eat, you're probably not going to be as hungry. Usually you won't eat so much. And often you may lose weight. And actually BioSlife is an integral part of several weight reduction programs that I'm involved with. And if you lose weight, your blood pressure will usually go down, especially if you do things like I talked about before, like exercise, extremely important. You know, I started my discussion outlining several of the major risk factors for heart disease. Remember what they are? Oh, sure you do. High cholesterol, high blood pressure, obesity, diabetes, and smoking. But if you stop to think about it, I've just talked about how BioSlife can reduce 4 of those major risk factors, haven't I? Namely cholesterol, high blood pressure, obesity, and diabetes. How about the 5th one, smoking? You know 21% of the people still smoke, and smoking is the most preventable of all causes of disease. Will BioSlife help that? Nope, sorry. You smokers just got to get a life, find some discipline somewhere and stop. And if you stop, you can add as much as 14 years to your life. And I believe that BioSlife is made by the best nutritional company anywhere. Unicity is rich in health maintenance tradition, with roots dating back over 100 years. Stuart Hughes, the dynamic and visionary CEO of Unicity, has assembled a hand-picked group of very talented and dedicated people around him to help carry out very effectively the motto of Unicity, to make life better. I admire their diligence, their integrity, their friendliness, and their constant search for cutting-edge preventative supplements like BioSlife. So let me recap. BioSlife is a natural, non-prescription supplement that works by 4 innovative mechanisms to decrease LDL. It may decrease your weight, lower your blood pressure, help control diabetes, maybe even help prevent cancer. Another very important use is in people already on a statin, as BioSlife may allow that person to lower their statin dose, thus decreasing the risk of side effects, while still maintaining their lipids in a safe zone. BioSlife is the only clinically proven, patented, safe, and natural alternative to statin drugs for effectively lowering cholesterol. You know, there are a lot of ways to treat heart disease, and I've seen just about all of them. Most of them are expensive. A lot of them are very painful. Just ask anybody who's had bypass surgery. And some of them just don't work. But the best way, the very best way to treat heart disease is to prevent it. And I've been looking for natural ways to prevent heart disease for over 25 years. And I've never seen a natural supplement that was even as remotely as effective as BioSlife or its preventative healthcare potential. So I think BioSlife should be taken by just about everybody that wants to protect their health. I've been around for a long time. I know only about half the people will take the natural supplements that they know they should take. Which half is it? Is this half on the left? They're smiling, saying yes, and they look pretty healthy. Or is it the half on the right? No, you know which half it is? It's the smart half. The half that first understands that they are at risk and then understands that there's something they can do about it. Prevent it. One of the problems with preventative products is you don't necessarily feel any differently. Your body loves the lower cholesterol, but probably won't know if your cholesterol is high, at least until you have your heart attack or stroke. There's no so-called positive reinforcement. For example, I don't know anybody that gets up in the morning, looks in the mirror and says, wow, I didn't have a heart attack last night. So you need some discipline. But if you have that discipline and do the preventative things you should do for your health, as the years go by and you remain healthy and happy, you can look in that mirror, smile, and say, wow, I'm glad I stayed on that road with the smart half. And I can think of nothing better to start and stay on that road to prevention and good health than BioSlife. It may protect, change, even save your life. An amazing thing, you can accomplish this by just taking a packet of BioSlife, stirring it in water, and taking it a couple of times a day before you eat. In closing, I hope I've answered some of your questions about heart disease today, and you now realize that there are significant things that you yourself can do to prevent this killer from striking you. The good news is that you are largely in control of your own health, since heart disease is 80% preventable. The decision is up to you. Take charge of your life and your health. Get physical, exercise regularly, eat smarter, watch your weight, know your numbers. Ask your doctor, hey doc, what's my HDL? What's my LDL? What's my blood sugar? What's my blood pressure? You need to know these things. Because when you become aware of a potential health hazard, like heart disease, gain the knowledge to deal effectively with it, and then act on that knowledge, you have the power to control your health. And part of this power also includes taking the supplements you need to stay in that smart half. It does what's necessary to remain healthy. And BioSlife is the best, most effective, most complete, most scientific supplement available anywhere. With BioSlife, you can firmly grasp the true meaning of the power of prevention. I want to thank you for your kind attention today, and I want to wish each and every one of you a long, happy, and healthy life. Thank you.
Thank you, Dr. Bresnahan. In the time that it took to listen to this message, more than 45 people have died from cardiovascular disease in the United States. This is shocking in light of what Dr. Bresnahan tells us, that 80% of those deaths were preventable. I can't personally think of a more effective way to combat heart disease than to start today with BioSlife. I urge you to contact the person who gave you this information to find out how you might use BioSlife to help combat heart disease. After hearing all of that, I can tell you I will use BioSlife for the rest of my life. Okay, you've heard the science, and you've heard from Dr. Bresnahan. Now let's hear from some other physicians. All are well-trained, highly credentialed medical professionals. All of us had a healthy measure of scientific skepticism initially, yet we were mature enough to realize that all the best answers in medicine did not necessarily come from prescription drugs. I invite you to listen very carefully to the following physicians. It might just save your life.
Hello, this is Dr. Mark Hamilton. I'm an anesthesiologist in Atlanta, Georgia, and it's a pleasure for me to speak with you for a few minutes about BioSlife. After my undergraduate education in chemistry, I completed medical school at University of California in Davis, and then completed my internship and residency in anesthesia at Emory University affiliated hospitals here in Atlanta, Georgia. I've been a practicing anesthesiologist now for, over 20 years. I've always been interested in cardiovascular disease, and as an anesthesiologist, I deal with cardiovascular disease on a daily basis. When BioSlife was released in February of 2006, I was impressed with their initial results, but frankly, as is my nature, quite skeptical. Therefore, I've spent hundreds of hours researching the data on BioSlife. Statins have been designated as the first-line therapy for reducing cardiovascular disease risk and have been extremely effective in lowering LDL cholesterol. What is less well known, however, is that even with maximal statin dosing and maximal LDL lowering, only 30% of cardiovascular disease risk is reduced. Other components of the lipid profile must also be addressed. HDL cholesterol and triglycerides are now receiving attention as being just as important as LDL cholesterol. A landmark review article was published in the Journal of American College of Cardiology in 2005, investigating pharmaceutical agents for treating the secondary targets of raising HDL and lowering triglycerides. They found that the best options for increasing HDL were niacins. Niacins commonly increase HDL approximately 15%. The best pharmaceutical option for decreasing triglycerides was found to be the fibric acid group of medications, and these commonly decrease triglycerides in the range of 38%. Therefore, the optimal combination therapy might consist of a statin to lower LDL, a niacin to raise the HDL, and a fibrate to lower triglycerides. The mantra over the next 10 years, therefore, will be combination therapy, as statin monotherapy will only reduce risk 30%. Combination therapy will become more and more popular. Enter BioSlife. BioSlife is a natural combination therapy. With 4 mechanisms of action, BioSlife has been shown to lower LDL cholesterol 31%. That's in line with the statins. BioSlife has been shown to increase HDL 29%. That's twice what is commonly seen with the best performing class niacins and 3 times what is commonly seen with the statins. BioSlife has been shown to decrease triglycerides over 40%. That's better than the fibric acid group of medications and twice what is commonly seen with statin medications. Combination therapy, therefore, will be the mantra and is the wave of the future. BioSlife is perfectly placed as a natural 4-mechanism combination therapy that impacts the entire lipid profile. BioSlife excels over any prescription monotherapy and compares favorably with the prescription combination therapies available today. I recommend BioSlife to everyone I know.
My name is Arthur Hagen. I'm a consulting cardiologist in private practice. I'm a fellow in the American College of Cardiology and spent 24 years in military and academic medicine, during which time I co-authored 130 scientific publications, also authored 12 book chapters and 2 textbooks. Since I resigned my position as Chief of Cardiology at LDS Hospital and tenured Professor of Medicine at the University of Utah in Salt Lake City in 1984, I've been in private practice ever since in Oklahoma, with a special focus and interest in primary and secondary prevention. I had been frustrated for many years of not being able to get a significant percentage of my hyperlipidemia patients to treatment goal as defined by the National Cholesterol Education Program by using prescription medications, diet, and exercise. In 1997, an internist friend of mine introduced me to BioSlife. After reviewing an extensive amount of medical literature on the health benefits of soluble fiber and completing my own clinical study in 240 patients, I've been personally taking BioSlife and recommending it to my patients ever since. My 3-month follow-up study in the 240 patients with hyperlipidemia, in whom diet, medications, and exercise remained unchanged, demonstrated an average decrease in total cholesterol of 30%. The LDL decreased 26%. The triglycerides dropped an incredible 79%, while the good HDL cholesterol increased an average of 30%. I currently have between 700 and 800 patients taking BioSlife. In addition to hyperlipidemia treatment goals being achieved better with the addition of BioSlife to their medical regimen, it's also very beneficial in controlling blood sugars in diabetics, as well as preventing recurrent hypoglycemia in non-diabetics. When BioSlife is taken properly before each meal, it's a very important adjunct to any dietary program for weight loss. The current NCEP treatment guidelines for all physicians are to recommend soluble fiber to all patients with elevated cholesterol. The only practical way to obtain the proper types of soluble fiber with proven clinical effectiveness is by taking BioSlife.
My name is Dr. Frank L. Murphy. I'm board certified in internal medicine and cardiology and am a clinical professor of medicine at the UCLA School of Medicine. I was the founding director of the UCLA Preventive Health Program, and in that capacity witnessed the clinical trials at Stanford University of a dietary fiber supplement called BioSlife that substantially lowered serum cholesterol. 4 years ago, I discovered that my cholesterol was dangerously high, 350 to be exact, and I was panicked. I began on the product, and after 2 months, my cholesterol had fallen over 150 points to less than 200. I then began trying the product on friends and selected patients and found similar responses, confirming the fact that indeed Unicity had come up with an all-new natural approach to the treatment of elevated serum cholesterol. Likewise, I have also used the Celery Essentials product for 4 years, and given my prior risk factors, I should have coronary disease. Again, my cholesterol before I started the BioSlife and Celery Essentials was 350, now less than 200. Former smoker, genetics very similar to my father who had premature coronary disease. Yet according to an ultra-fast CT scan I had done, my calcium volume score came up 0. This scan is extremely sensitive for coronary disease and shows that I have no evidence of heart disease.
My name is Dr. Dan Nelson. I was head of our cardiology division at one of the 12 largest multi-specialty medical clinics in the United States for 11 of my 22 years of practice. I am currently a working interventional cardiologist and have been treating patients with angioplasty since the early 1980s. Since then, I have been fortunate to use directional atherectomy, coronary thrombectomy, laser techniques, and rotoblator catheters in the ensuing 15 years for both elective and emergent procedures. I have inserted all types of coronary stents as they became available since the early 1990s. These techniques have been premier breakthroughs in the history of medicine for the treatment of our patients. Unfortunately, these gratifying treatments we talk about will in no way prevent the primary problem, which is rampant disease of the body's arteries, an epidemic that is responsible for 50% of the deaths in the United States year after year and is brought on by the inability to control cholesterol in our diets as a major factor. When we talk about alternative and preventive care for our patients, I would confirm to you that physicians in general are quite skeptical of these products, and cardiologists are without a doubt one of the most skeptical groups. However, I was quite intrigued by the initial discussion I heard, and in view of my family history of coronary disease, I have since used BioSlife in combination with my current statin drug. I've dropped my total cholesterol to 105, a full 70 points below a respectable level with the statin drug alone, and my bad LDL fraction dropped to 60, 35 points below the previously thought adequate level achieved with the statin drug alone. In addition, my triglycerides dropped 60 points to 50. I was astonished that this great formulation could do this for me and was convinced that it should do the same for many of my patients. It gives me great pleasure to introduce it to my patients, a great many of whom are on fixed or limited incomes with staggering prescription costs for more expensive forms of therapy. Many of them have already experienced great results.
Philip Boudreau here. I'm a University of Minnesota trained transplant surgeon, a professor of surgery, been in practice for over 15 years now, board certified in general surgery and critical care. I was first introduced through the Unicity product line through Rexall about 5 years ago, through my partner and through my wife, who became a independent business owner, and I had a cholesterol challenge and was able to successfully lower my cholesterol 50 points with the BioSlife 2. I was new to the concept of nutraceuticals and alternative health care, but was being somewhat frustrated by some of the things that were happening in the practice where, as you know, I am one of the doctors of the last resort, and that people come to me when it's broke so bad it can't be fixed and needs to be replaced. And so transplanting patients with perfectly good livers or pancreases or kidneys, only to have them succumb a few years later to the same thing we all get, strokes and heart attacks and cancer and other presumably preventable disease, One particular experience that struck me and I guess really made me take a serious look at this method of providing care for patients was when a patient came to me about 7 or 8 years after his combined kidney pancreas transplant. He was about 33 years old, had diabetes and renal failure. He had diabetes since a very early age. He had a successful pancreas and kidney transplant, and then after about 4 or 5 years was seeing other physicians because his health plan changed. He then showed up in my office after a several-year absence and said, "I really would like to see you even though you're, quote, out of plan." I said, "I'd be happy to see you. I haven't seen you in 3 or 4 years. Tell me what's going on." He was very pale. He had orthostatic hypotension with a blood pressure supine of 170 over 110, and standing his blood pressure was 80 over 40. He had angina walking about 20 feet. He couldn't carry a laundry basket of clothes down the hall in his house, and he would get chest pain going from his car park to his office. He was hospitalized right away and evaluated by cardiology, and to make a short story even shorter, he had non-bypassable, non-correctable coronary artery disease. He also had profound Shaw-Drager syndrome with orthostatic hypotension, and his cardiologist gave him about 6 months. His kidney and pancreas transplants were working fine with normal serum creatinine and normal fasting glucoses and hemoglobin A1C levels. His 42-year-old brother had just died of a heart attack. His 44-year-old brother had just had a 4-vessel bypass. He was 43. And I was recently aware of the BIOS Life and a new product called Cellular Essentials, which was designed to reverse coronary artery disease without surgery. And this patient certainly was not a candidate for surgery. He also had a serum cholesterol of 280. And I offered him some BIOS Life and Cellular Essentials and said, "Would you be interested in trying something alternative to what you're trying now, since it doesn't seem to be anything that we're doing seems to be working?" By this time, he had been 6 weeks in the hospital, and everything that was given to improve his supine hypertension made him more severely orthostatic and worsened his angina. Anything that was given to improve his orthostasis also worsened his angina. And he went home taking BIOS Life 2 and Cellular Essentials, and I was really curious to find out what would happen and whether these products would interact with his immunosuppression, and there was absolutely no reason to suspect there would be any adverse reactions, but still I was a skeptic and uncertain. 6 weeks later, he walked into my office and said, "I'd like to go back to work." I said, "What are you talking about?" He said, "Well, I mowed my grass yesterday. I didn't have any chest pain." His blood pressure, supine and standing, was 120 over 80. His cholesterol had decreased to 180 with no change in his diet and on no lipid-lowering agents. So we let him go back to work. About 3 months went by, and I couldn't get him back into the office until after consistent badgering. I knew he was still thriving. I would get his twice-monthly labs across my desk and showing everything was in good working order, but I couldn't get him back in the office. Finally got him back in the office at the end of the summer and sort of read him the riot act for asking where he was all summer, and he said, "Well, I just came off of 109 days straight of 12-hour shifts." He worked at a plant as an engineer, and we had a big plant turnaround, and I couldn't leave. Now, this was a man who 6 weeks previously was sent home to die, and was now working 12-hour shifts without chest pain. His dobutamine stress echo, which had showed about a 10 to 15% ejection fraction, now had about a 45% ejection fraction, and a lot of his hypokinetic portions of his heart were now beating vigorously. And this, I guess everyone has a seminal event that sort of convinces them that this is definitely worth a second look, and I guess that was my defining moment. I encourage you to look seriously at this project and seriously consider what benefits these products may have for you personally and in your family members and people you care about, as well as your patients. Thank you.
My name is Chet Gentry. I'm a board-certified fellow of the American Academy of Family Physicians. I went to medical school at Michigan State University and began my family practice residency at the University of Virginia in Charlottesville and completed my residency at Roanoke Memorial Hospital System in Roanoke, Virginia. I have a large population of diabetic patients who are treated through a comprehensive disease management system. Our practice participates in a national research network which extracts information and compares outcomes data with other practices based on clinical performance measures such as cholesterol and A1C levels. In 1998, our practice received the Best Practice Award for Diabetes. I recommend BioSlife as part of our nutritional component and have seen impressive reductions in total cholesterol, triglycerides, and LDL levels, decreased medication requirements, and in some cases we have avoided the need for insulin injections. In combination with lifestyle changes in diet and exercise with newly diagnosed diabetics, I have seen BioSlife contribute to greater than 100-point drops in triglycerides and 20-point drops in total cholesterol and LDL. In cases where BioSlife was the only significant variable changed, I have come to expect a change in lipid profiles similar to what we would see with the addition of Lescol, a commonly used anti-cholesterol drug in the statin family. I have seen several additional results with BioSlife. Symptoms of gastroesophageal reflux are reduced. The incidence of constipation and subsequent hemorrhoids are reduced, and postprandial spikes in blood sugar are reduced. In light of the cholesterol and glucose-lowering benefits of BioSlife, combined with the numerous other known health benefits of fiber, particularly the blend of fibers used in BioSlife, the recommendation of this product to my patients is a no-brainer. I have had patients stop taking the fiber, thus requiring increased doses of diabetic and cholesterol-lowering medication. After experiencing the side effect of the medications, including muscle pain, weakness, or elevation of liver enzymes, many of the patients who stopped taking the fiber return requesting to start back on BioSlife.
Hello, I'm Dr. Stuart Lonke, board certified in internal medicine, pulmonary medicine, and critical care medicine. I completed my internal medicine training in New York and at Barnes Hospital in St. Louis, and then I completed my pulmonary fellowship at UC San Diego as a National Institutes of Health Fellow. After 10 years on the faculty there, I entered private practice. Now, my experience with Unicity's product began a little over 4 years ago when a trusted colleague introduced me to BioSlife 2. With a cholesterol over 250, I needed something, and I was very reluctant to make that something a pharmaceutical product. 6 months later, on BioSlife, my cholesterol was under 170. I felt great, and I'd lost about 30 pounds. Needless to say, I made it my point to recommend this product to all people with elevated cholesterol levels and with challenges of blood sugar control who preferred a non-pharmacologic approach to their problem. But it isn't just BioSlife that's impressed me. You see, Unicity is a unique company in the nutritional industry. It's become the industry standard in scientifically based nutritional companies, with 2 products listed in the physician's desk reference. One is the BioSlife I already mentioned, and the other is a remarkable product called Cardio Essentials. Now, this all-natural product, with a per-dose concentration of coenzyme Q10 that's a multiple of that contained in other products on the market, has been formulated with nutritionals like carnitine and taurine to support healthy heart and muscle. I was intrigued with this product when I heard about it and its potential to support heart function. And I can now say that I've had the occasion to use this product on 2 patients with severe heart failure, both of whom were awaiting heart transplantation. Now, the first fellow was 50 when I started him on this product, and he had an ejection fraction of under 15% on 2 successive echocardiograms. He was on the list for a transplant and was actually able to stay out of the hospital for a total of 12 weeks while he waited for his donor heart. His response was a modest increase of his ejection fraction to just over 20%, but he remained functionally stable at home until his transplant 4 months ago. Now, the second case is actually far more dramatic. This 52-year-old gentleman has been my patient for a little over a year. His heart function deteriorated from a combination of atherosclerosis and hypertension to an ejection fraction of also just under 15%. His legs were swollen. He had fluid in his lungs. We tried 2 different approaches to treatment, both of them using drug therapy under the guidance of a team of heart specialists. Both failed. The ejection fraction on 3 different occasions, about 6 weeks apart, was still 15%. Well, as a last resort, the cardiologist gave his okay to a trial of Cardio Essentials, and I am very happy to say that 5 months later, this man currently has an ejection fraction of over 30%, a doubling, and we've measured it twice. Now, he's decided to hold off on a transplant. He's still on the list, but he's actually bypassed 1 donor heart. His legs are now not swollen. And he's now responding to diuretics. He's actually begun getting out of the house again and beginning to socialize. Now, I know you'll admit these are amazing results. I know that. But they weren't unexpected. It's what I've come to expect from a company that does all the work before it releases its products. It's why I never hesitate to promote and personally use Unicity Nutritionals.
I am Dr. Sylvester Dahme. I graduated from the University of Kansas School of Medicine. I have completed 4 years of postdoctorate education, and I am board certified in family medicine and am a fellow of the American Academy of Family Practice. I am also a fellow of the Association of Emergency Physicians. I own and operate Midwest Emergency Physicians, and I am an assistant professor of medicine at the medical school. I also am director of a family medicine training program where we actively are training 50 residents to become board certified in family medicine. I am a big advocate of BioSlife and the tremendous impact that it has on positively impacting one's health in the prevention of heart disease and cancer. My father died of colon cancer, so that is a major issue for me. It has put me in control to lower my risk for this terrible disease. I have also lowered my total cholesterol by over 65 points since starting BioSlife, and I have painlessly lost 25 pounds. I had a heart scan this past year, and it revealed absolutely no detectable lesions whatsoever. I have had the great pleasure to see many lower their cholesterol and concomitantly lower their risk for coronary disease by sharing the good word about BioSlife 2. BIOS is the world's #1 viscous fiber supplement, and it fulfills the requirements for the NCEP guidelines for treating high cholesterol without using medication that would have potentially devastating side effects. We are all too aware that the 4th leading cause of death in the United States is from side effects of prescription drugs that are both prescribed and taken properly. I never start my day without BioSlife.
My name is Dr. Stephen Bloom. I have been in the practice of family medicine for more than 20 years in Boca Raton, Florida. I utilized the BioSlife in my practice for several years, having numerous positive responses with type 2 diabetic patients, helping them to reduce their oral medications, and even getting some patients off their oral medications permanently. Even more impressively, I witnessed lipid levels lowering dramatically. Personally, it has been an interesting experience as I have utilized BioSlife as an adjunct therapy for myself. I had a total cholesterol of nearly 400. I started with Mevacor, later switched to Zocor, then switched to Lipitor. Although they lowered my cholesterol, I did experience some side effects with each drug. Although my personal results using BioSlife were acceptable, my main motivation to continue the BioSlife was due to the findings of a Harvard University study which incorporated over 40,000 participants. They increased their fiber intake to 30 grams daily, which is almost impossible without supplementation, and they reduced their coronary risk factors by 30%. When the upgrade to BioSlife was presented to me, I implemented it immediately, and to my astonishment, in just 2 weeks, I had an LDL drop of 20 points, something I was unable to accomplish in the history of treating my elevated cholesterol with statin medications. There is no doubt this formulation should be used as a primary approach to the treatment of hyperlipidemia, as well as be presented to diabetics. There is just no point in jumping to the statins if this option exists.